Hello, thank you for joining me today. My name is Dr. Laura Headley and I'm a nutritional scientist with Evonik. And firstly, I'd really like to thank the organisers for inviting me to come today to talk about Medox. And I'm going to bring to you both the story and the science behind nature's potent anthocyanins. So you may have seen this special guy playing the other weekend. We were very proud to have Medox, our brand, on the shirt for Dortmund. And hopefully you enjoyed the game. Now, who is Evonik? So Evonik is one of the leading global specialty chemical companies. We're based in Germany. We're a German company. We have a very large number of sales, as you can see, 13 billion euros in sales last year. We are progressing towards a new structure from the 1st of July, but as you can see, our work crosses many divisions. We have nutrition and care, specialty additives, performance materials, and smart materials. And really in Evonik, we use chemistry to make life more sustainable, more efficient, helping things work better for you. And as you can see, there's a section there called healthcare. Now, healthcare in this section here where I work is about making pharmaceuticals, making drug ingredients, medical devices, and nutraceuticals, which are in essence dietary supplements. Now, for healthcare, the section, we have many units across the globe, manufacturing sites, research sites, laboratories, sales offices. I'm actually going to take you to a special place in Norway called Sandnes. Now in Sandnes, they make this product, and this is Medox, which we're very proud of. Medox is produced based on wild, hand-picked bilberries from Scandinavia and blackcurrants from New Zealand. Wild bilberries are really the secret to this product. They are very special. They're significantly higher concentration in valuable anthocyanins, which is the extract that we use, compared to cultured bilberries, which you might be more familiar with. Now, Sandnes is absolutely glorious, especially this time of year and also in the winter with the snow. It's very lovely. But here in our manufacturing site, it is really state-of-the-art extraction, production, research, innovation, and also customer service and marketing. And what's special about the bilberries is that they grow wild. So they grow down low in these bushes, as you can see, where the lady is hand picking the bilberries. These must be hand picked. They grow very separated out on the bushes, very low down. So it's a very hard work for the pickers. We then come into the manufacturing site here, where you have the extraction of the anthocyanins from the berries, and you make the capsules until finally you have the final production of Medox. Okay, so I've mentioned anthocyanins already. What are they? So anthocyanins give the colour that you see in the skin and the flesh of berries. And the berries used in Medox, which are, as I said already, bilberries and blackcurrants, are known to be some of the richest sources of anthocyanins in the diet, so they're very important. Berries contain a variety of anthocyanins. In fact, for bilberries, we know of at least 16 in there, and blackcurrants have 4. And we also know that they have synergistic effects. So from previous research, we've seen that when you use one anthocyanin, you can reduce a special inflammatory marker in the body. When you look at another anthocyanin, that also does the same job. When you combine the two, as found in Medox, it reduces inflammation even more than the separate anthocyanins. And for each berry, the main anthocyanins that we know of are the cyanidin and the delphinidin varieties, but there's also smaller proportions of others such as petunidin, peonidin, and malvidin. And here, just here on the slide, we have the basic structure of the anthocyanin, and then the sugar changes, and different sugar units then creates a slightly different type of anthocyanin. So why do we care? Why should we take a dietary supplement of anthocyanins? Well, there's a few reasons. There's practicality and there's technical reasons. So the practical reasons are things like, can you really expect to consume enough berries every day to get that consistent effect? also bilberries and blackcurrants aren't widely available in supermarkets or even farmers markets as you would need them in the volume and the consistent quality no matter the season. So it can be expensive. It can also be a bit of a chore to eat the same foods every day, and it's not, as I say, particularly practical. Technology is our friend because the extract is produced using a patented process. It requires quite refined science and technical know-how to extract these anthocyanins from the berries intact and maintain their activity in order to put them into the capsule and supply them in a stable dose for the consumer. So we can guarantee through technology that we can overcome the seasonal fluctuations that you naturally find in anthocyanins in the raw material to ensure 80 milligrams of anthocyanin per capsule of Medox. Okay, so visually what goes into a capsule, so you have maybe 2 handfuls of blueberries. If you were to think about blueberries that you see on the market, you would need 2 large handfuls of those every day to get the same amount of anthocyanins as you would find in a single capsule of Medox. And the reason why bilberries are so special is because they grow in northern European forests, so they're wild, versus the cultivated versions that you might see in the supermarkets. They're harvested by hand because I said they grow quite sparsely among the bushes, whereas the cultivated versions are harvested by machines. And the real key difference is that here in your blueberries, you find you have the lovely blue skin, but the flesh is kind of a greeny, maybe clear flesh. And there's a relatively low anthocyanin content actually overall, whereas the bilberries here have a very red flesh and the skin, which creates a much higher, richer content of anthocyanins, which is very valuable. So we really have a unique product here with Medox. We have a unique combination of ingredients. You have the bilberries and the blackcurrants. You have the wider range of anthocyanins available in the bilberries and the smaller number of anthocyanins in blackcurrants, but they complement very nicely with the anthocyanins in the bilberries. We have the special technology needed in order to keep the anthocyanins safe and transferred into a consumable product. And then you have 20 years of science behind the product. So we have not funded research directly, but within the academic arena, researchers have found the functionality of Medox extremely interesting. And then there has been this organic growth in research that has been essentially driven by research interest, intellectual interest of the academics involved from universities and university hospitals, and they've taken it upon themselves to research Medox as they see fit. So Medox has been involved in a variety of trials, including things like looking at diabetes, type 2 diabetes, liver health, fatty liver disease, brain health as well, cognitive function, but the real concentration of research has been on heart health, and that's what I'm here today to describe a little bit of, because there is a lot to talk about, and so I have to be very selective, which is a great position to be, but unfortunately I can't tell you everything today. So the progression of atherosclerosis is really what we're interested in with Medox. That seems to be where Medox has its special application. And atherosclerosis is what we talk about when we think about heart disease. Normally, that's the kind of visual that we have. So imagine this is the artery here. So I'm just going to use my mouth to show you. So you have the artery here. And this is a nice, normal, healthy artery here. And then you can slowly see the progression of what's essentially fatty acids, so lipid, cholesterol, and other cells slowly collecting within the wall of the artery to collect this plaque. And this is where the risk of heart attacks and strokes and other disease processes come from, when the artery is, the diameter of the artery becomes compromised and becomes smaller and smaller and smaller because of this lipid that is now collecting within the wall. So we would like to keep everybody here. Unfortunately, biology does take a role and life takes its toll and things can start to progress. And we believe that Medox can help reduce the progression, slow the progression, or perhaps just lend a helping hand to your arteries to help keep them as healthy as possible. So here we're talking about endothelial dysfunction, and endothelial dysfunction happens when the cells that line the artery, called the endothelial cells, can't make a chemical called nitric oxide as well as they should be able to. And the reason why they can't make it as well as they should be able to is because there's issues with cholesterol levels, maybe a bit high, the person is not doing as much activity as they could be, a poor diet, other factors, high blood pressure, and there's a few other things. So nitric oxide is protective of the endothelial cells, and when it's not there, that means basically an inflammatory process can start and the cells start misbehaving. They start producing chemicals that are not helpful, and you can then start this process, finding this process starting of the lipid collecting in the artery wall. Now, we have data from Medox studies to show that endothelial dysfunction is improved very quickly with Medox. So within the hour, we've seen an improvement with Medox, and also when taken over the longer term. So you also get that longer term benefit. But there's more to this that Medox can have an improvement with. So we have found in previous studies, so this is from human trials and from cell culture trials, lots of different types of studies. We know that, for example, so these are the endothelial cells that I'm talking about, and this is the lumen. So imagine the blood is coming here, and this is the artery wall space here. So these cells lining here that I'm just using my mouse with, the endothelial cells, they can start, when the nitric oxide isn't there or it's not working as well as it should, they can start producing chemicals that make the cells quite sticky and attractive to monocytes, which is a type of immune cell. And so we know that Medox is involved in reducing the level of those sticky factors called VCAM and other elements. We know that Medox has been shown in trials that the chemical that is produced when cholesterol levels, LDL cholesterol, is oxidized. So we're talking about oxidative stress here. Markers of oxidative stress go down when Medox is given to humans. We know that inflammatory markers go down when Medox is also given to humans. Really important inflammatory markers are IL-6, that has a very big role in progression of heart disease. And we also know that there's an activity called cholesterol efflux, which is basically when your good cholesterol, your HDL cholesterol, comes along, and the macrophage here that has basically ended up swallowing some cholesterol and then forms the lipid core that we saw in the picture before. The macrophage gives up the cholesterol to the HDL, and the HDL takes it away and goes to the liver. Now, this is a really key element of Medox and a very, very helpful element. So it's cholesterol efflux. And we see from Medox studies, so there's been 17 human trials, of which 5 have dedicated themselves to looking at lipid metabolism in particular, so cholesterol levels, how cholesterol levels change when you take Medox over a consistent time. And we can see here in this graph on the left-hand side, you have LDL cholesterol. So LDL is your bad cholesterol. It can go too high, so you try to keep it as low as you can. So the graphs show that the mean change in LDL cholesterol after 4 capsules per day of Medox, so it's quite a high dose, but we want to see what change is possible with Medox research. So for 12 weeks minimum, so between 12 and 24 weeks, these studies were taken, but 12 weeks minimum, you can expect to see an average reduction in LDL cholesterol of 10%, which is quite impressive for basically a berry extract. For the HDL cholesterol, the good cholesterol that you want to go up as high as you can, we found a 14% increase with the same dosage of Medox in the same group of people. So this was putting together 5 clinical trials literally just averaging the cholesterol changes over the 5 studies, but it included 600 participants, of which half were assigned to Medox and half a placebo. It was all randomized, double-blind, placebo-controlled trials. And all participants starting the trial were termed as dyslipidemic, so their cholesterol levels were not optimal at all. So they needed some kind of intervention to help their cholesterol levels. And I have the papers down here. And later on, there's a website where you can go and find the papers yourselves. And please feel free to read through the trials. Now, just going back to cholesterol efflux, so that green square where I said it was a good thing. So this is good because you have LDL cholesterol in the cartoon coming and dumping the cholesterol into the artery wall, in essence, which will then build the plaque. And you don't want this. What you do need is this helpful man here, HDL, to collect the cholesterol and take it away to the liver and be gone. And this we've seen with Medox, with our independent researchers, increased by 35%. And there's some other studies as well from a few years back that support this too, that there is a really nice mechanism happening here with HDL cholesterol, where the HDL levels go up. They seem to be very effective, taking away the cholesterol, and there's some other markers that have been measured as well to support this proposed mechanism. So again, I really encourage you to look through our research and have a good read. So Medox also has an effect on platelets. There were 2 studies in Australia that ran a few years back in 2017. And the 2 studies ran for 4 weeks each, and they were looking at people who were either sedentary but healthy, or were essentially healthy but overweight or obese. And they wanted to see how the activity of the blood clots, or the risk of blood clot, may change, and the activity of the platelets may change with Medox intervention. I'm diving quite into some technical language here, but basically monocyte platelet aggregates form they tend to be seen in people that are at risk of heart disease, so you don't want them to be there. It kind of means that your platelets aren't behaving as they should. They're a little bit hyperactive, a little bit sticky, and they need to be controlled or tamed. So in very simple terms, these sticky platelets that were forming with monocytes, again, we've seen monocytes before, the artery wall, so the type of immune cell, they can come together and form aggregates, and you don't want those. And they were reduced by 39% in sedentary cohort and 29% in the obese and overweight cohort. And PCAM and P-selectin, they're kind of the same kind of sticky elements that you find at the artery wall or on platelets, and we don't want those either. They do have a role, but you don't want them too high, and so it's better to bring them down. And the platelet aggregation overall, again, was suppressed. So you have this real change in platelet behavior. They become more under control, less sticky, more useful and to health. So, and you can see in this graph here, so we're talking about here the monocyte platelet aggregations. This is the percentage that were found, and the and here is the pre-anthocyanin group. So the people that were blinded but ended up having the anthocyanin intake, the Medox, before the trial. This was their level, and then we've shown statistically significant reduction post-intervention, so after 4 weeks in healthy people. So that's a very important finding. Okay, so now we've had some really new data from 2020. This study was released in April. And going one step further, we now have some dose response data, because we've always, so far, the academics have always looked at 320 milligrams of anthocyanins per day. And everyone may have their own reasons, but for my interpretation, this is basically because when you run nutrition trials or trials of this manner, you need to make sure that you give enough of the intervention to cause an effect. to try and trigger the pathway that you want to see. Why? How can this intervention have an effect? What is going on? And then as time goes on, once you've built up your literature, you can then kind of pull it back a little bit and look more detailed at, okay, lower doses. What can a lower dose do? Can we get the same effect or enough of an effect to confer a health benefit? And we see here in this study was 169 men and women aged 35 to 70. So really nice, lovely, diverse population of age and gender. And it was found that there was a minimum daily dose of 80 milligrams of Medoc. So 1 capsule a day versus the 4 a day in the other studies was enough to have a benefit to health. So the key findings here were that there were significant reductions were recorded in the plasma IL-6 when compared to placebo. So IL-6 is an inflammatory marker that is just everywhere. And if you are a little bit overweight around your middle, so you may have visceral fat, visceral obesity, that is an active organ, and that will be along the lines of producing IL-6. IL-6 is particularly quite dangerous in terms of artery health and heart disease. It really can fan the flames of heart disease. So to have it lowered is very important. And so, as I said before, yes, this graph shows here. So at baseline, mean change from baseline. So did anybody, what happened? Did you go up or down compared to where the participants started from? So for placebo, there was no change in IL-6. When people took essentially half a capsule a day, yes, they came down a little bit, but it wasn't statistically significant. So there's probably too much variation in that group. So some people might have had quite a good reduction, and some people might not have seen any. It wasn't quite enough to get everybody down. For the 80 milligram group of Medoc, so 1 capsule a day, there was a average 20% reduction in IL-6, the inflammatory marker, which is absolutely key here. And then, of course, as is expected, 4 capsule days, yes, a very emphatic reduction in IL-6, as you can see here. And what's really exciting is that this line shows that there is a dose response. There is a statistical dose response, and that's what this 3 asterisks mean here. It's very significant, it's highly significant. So this effect was greatly enhanced, as would be expected, at the daily dose of 320 milligrams per day. But there were significant reductions as well for 80 milligrams, also recorded for TNF-alpha. And so dampening inflammation, reducing inflammation in the body is a real key step in supporting the prevention of heart disease. So Medoc is a powerful anti-inflammatory for all ages, as we saw in the study before. And one of the earliest studies of Medoc from 2007 showed that in healthy people there were good changes in inflammatory markers that were beneficial. So we know anthocyanins have a role in heart disease. We don't want them, we don't want the inflammatory markers around, so we need anthocyanins. They're very useful, but they're also useful for things like exercise recovery and fighting off illness, which you might not know. Things like colds, flus and viruses, anthocyanins are very helpful for. Now Medoc hasn't been used in that kind of research yet, but just as an aside, as a general note for anthocyanins, we do have that kind of research available. So what do results mean in real life? Okay, so if you look after your heart, you also look after your brain, because many of the risk factors for cognitive health problems are also with heart disease. So you need to keep your blood flow nice and smooth, good circulation, lots of activity, keep inflammation down, and that can help you there. If you have poor liver health, so I'm talking about non-alcoholic fatty liver disease or type 2 diabetes, then Medoc does have a role there as well, and can improve outcomes. They are smaller studies and more research is needed, but there is some interesting data. But it all kind of feeds back to heart disease, because if someone has type 2 diabetes, then their risk of heart disease is a bit elevated. And if someone has the non-alcoholic fatty liver disease, so there's fat has infiltrated into the liver, largely because someone is probably overweight or sedentary, and sometimes it's associated with those kind of factors, then there will also be a degree of risk of heart disease. So they're all interconnected. And yes, there is some really nice data looking that anthocyanins in general have an antiviral effect. So there is some cell culture studies using bilberries from a separate group, not from Medox, but from bilberries, where they stopped the virus replicating in the cell culture. And the same for black currants. There's also that kind of data. So that's a really exciting avenue for anthocyanin research. So, as I said before, there's been 20 years of research supporting Medox. And if you would like to access any of the studies, please visit our website. We're absolutely happy to share the research. It's all open access. It's all there to be read. And also feel free to visit medox.de, and that gives you a lot more background on Medox itself, obviously all in German. If you prefer English, there's also the English website, medox.co.uk. We're very happy to offer up our science behind the product, and also our knowledge of the product for many years, and yeah, we can help you in any way. So thank you very much for listening. Thank you for your time. I really appreciate it. Please do get in touch via the website if you have any questions, and we'd be very happy to hear from you. Thank you very much.